episode has been brought to you by Schedulicity.
A little note here about last week's podcast. Before I dive in here, Connected Yoga Teachers, I was talking about my amazing chair, the Sukhasana chair, and I forgot to give you a coupon code, which Carl of Sukhasana was so kind to give to all of us. So if you are interested in the Sukhasana chair, make sure to go check it out at sukhasana.com. And if you're purchasing a chair, make sure to use our coupon code TCYT10. Again, that's TCYT, just like in the Connected Yoga Teacher 10. And if you're out on the go, don't worry, I'll make sure that we put this in the show notes for you. Hello and welcome to the Connected Yoga Teacher podcast. I'm your host, Shannon Crow, a mom of three, a yoga teacher, and a trainer and consultant who works for yoga teachers. And this podcast was created for you so that you can connect to the information and inspiration every single week and feel supported as you navigate these sometimes very tricky jungles of being a yoga teacher and also an entrepreneur. Today's episode has really been inspired by your questions inside of the Connected Yoga Teacher Facebook group. If you're not already a member, come on over and join us. We have a lot of fun in there and a lot of great questions get posted. And sometimes I think, you know what, that's one that keeps coming over and over again. Let's answer that in a podcast episode. I also want to tell you that at the end of today's episode, I want to try and share a personal update. And I say try because I'm going to try and get through it in sharing a personal update on how COVID has really impacted my own family. And so I just want to let you know that today's episode, as I'm hitting record right now, feels like it really hits home. And I want to share that with you at the end. So one of the things that we've all had to adapt to recently in our yoga businesses, but also in life, is this COVID-19 pandemic that we are still living in. As I'm recording right now, Ontario is in lockdown until possibly the end of this month, maybe longer, depending on how our numbers are. Because we understand more about how the virus spreads, the official stance of the World Health Organization and other government bodies is to really encourage the use of masks, in addition to other measures to reduce transmission. And as yoga teachers, this impacts us when we start to open up our spaces again, or if we're wondering, what are the policies and procedures that I need to be aware of? Today's episode is definitely not telling you like, do this and don't do this. Today's episode is really about sharing the information so that you can make an empowered choice. I invited Clare Kelley to share her expertise in this area and to clear up some of the doubts or confusion, or to answer the many questions I've been hearing about masks and yoga, and on a much broader perspective, how public health relates to yoga. I am super excited about this because when Claire and I first connected, she was really open with me talking about how wearing a mask was something that she had to get used to, that it made her really uncomfortable. It was uncomfortable to wear. She felt like she couldn't breathe. She talks about that a little bit in this episode. And I also knew that Claire was a great fit because she's a yoga teacher and also has worked in the public health space for a long time. And we talk about why there was so much confusion at the very beginning of this pandemic. Remember back when we were wondering, should we be wearing masks? And different government organizations were telling us different things. Claire has some insight about what's best for yoga teachers and studios and how to address concerns that your students might have, such as, am I going to get enough oxygen while I'm wearing a mask and doing yoga? What if I don't feel comfortable wearing that mask? How far apart should we be? All kinds of questions. Claire covers a lot of this. And like I said at the beginning of this episode is meant to be a really impactful and useful resource so that you can make empowered decisions and choices for yourself, your yoga space, and your yoga students. And as we've all come to realize in this, there are different times where we are making different choices. I have a senior in my family who I was going to see every week before lockdown. And all along the way, I feel like what empowers me is information. So I take a lot of comfort in learning about something and then making the choices. All of our show notes are ready for you over at theconnectedyogateacher.com/202. And before we dive in and meet Clare, I want to give a huge shout out of thanks to our sponsor, Schedulicity. Schedulicity is a company based in Bozeman, Montana, and they are just an amazing group of people that really takes care of yoga studios, yoga teachers, and all kinds of other professionals who need an online scheduling software. Let's hear our hot tip of the week from the team over at Schedulicity.
Now the Schedulicity hot tip of the week. Save time with our super fast check-in. Schedulicity keeps track of anyone you've added to your class roster, as well as anyone who's booked online. Then, as they walk in the door, all you need to do is find them on the roster and hit the check mark next to their name. New students will be marked with a star, so you don't have to try to remember who's already filled out your new student paperwork. With the payment add-on that works with Square and Stripe, you'll see if your students have already paid you online. If you have walk-ins that didn't book online, it's super easy to add them as a client, or if they're already in your system, just find their name. Save yourself some time and energy. Check in with Schedulicity.
If you haven't already heard of Clare Kelley, she is the founder and director of Wild Wisdom, a platform that exists at the intersection of science, movement, nature, and lived experience. Clare has completed her graduate studies in both public health and health research and program design, monitoring, and evaluation, and has over 8 years of experience working as a health consultant. She also has training in many mind, body movement, and healing modalities, including nature therapy, Pilates, yoga, natural functional movement, and myofascial self-massage. Clare's work is helping people connect to their nature and the nature around them for the health of both. And what's really cool about this is Clare is actually on Patreon, and she shares live movement classes and nature therapy walks, meditations and visualizations, movement and relaxation videos, public health explainers, essays, and so much more. So if you really connect with Clare today, you can connect with her further. All of the links for that are in our show notes. Let's dive in and learn from Clare about yoga and masks. Welcome to the Connected Yoga Teacher Podcast, Clare. It's great to have you here today.
Thanks so much for having me, Shannon.
I am really excited that we get to talk today about masks in the yoga space because so many of our yoga teachers have had questions about this. You and I have been chatting back and forth about getting together and doing a podcast episode, and I feel like, yay, it's finally the day. For our listeners who don't already know you, tell us what's the work that you do and who do you do it for, and how does talking about public health and masks come into your world?
Sure. So for many years, I worked for the American Society of Hematology, so working with blood diseases, and I was a program specialist. And I also went to grad school then to get a double master's in, the first was an MPH, a master's in public health, in global health, specializing in study design, monitoring, and evaluation. And then I also did an additional master's that clicked in with that one on looking at it from a more qualitative research, from a qualitative standpoint. So less about the numbers and more about how and why we do things. And then a number of little life things came in the way, or major life things came in the way of doing that work really directly. And so since about 2014 or so, I have been working more in the wellness world and weaving together all of these different traditions of public health science, yoga, movement. I've been studying my own ancestral traditions in Celtic wisdom, and I'm also a nature and forest therapy guide. So I see these as all interrelated around all of the different ways that we look at to take care of ourselves and the collective.
This is really fascinating. So I know you from our yoga teacher groups and that side of things. And then from some of your answers in the Facebook group, that's when I was like, wait a second, you seem to have quite a stronghold in the public health world. And You had a lot of answers for people. So I really appreciate that you think it weaves in together so well, because I think sometimes it can feel like when we study yoga, it's very separate from like our medical side of things. But you think it weaves in really nicely together.
Yeah, absolutely. And it goes to perhaps explaining the difference between public health and medicine. So when we think about doctors, allopathic medicine, naturopathic medicine, right? They all have their place in this larger healthcare system. They're treating individuals. So you go into them with what's ailing you, or to go in for your physical, your wellness check, and they work with you at an individual level to help you strategize how you are going to have what is your standard of well being. In public health, we're doing this for the community. So we're looking at how do we keep whole communities safe, healthy? How do we work for the well being of a community? Because our own individual efforts protect us, but also how we look at health individually affects the community, particularly when we're talking about something called the social determinants of health. So that's how our own individual roles, actions, beliefs, attitudes, and behaviors have an effect, whether direct or indirect, on all of these different things that can affect our well-being. So, we can get into this a little bit more, but for example, one thing is that by me wearing a mask, because a mask isn't so much protective for me, it's protective for other folks. Um, so, in doing that, I'm also taking a stand against racism. We know that there's huge medical bias that is systemically keeping people of color, BIPOC color, women, all kinds of different communities from accessing healthcare at the highest levels, at the best levels. And so, when I'm taking these little tiny measures, I'm saying that the health of a larger community outside of me really matters. And so that kind of, if we think about how that goes back to our yoga practice, that's the fundamental of yoga. We're looking at action, kriya, to take this into how do we play with the yamas and niyamas? How do we put those into work through our lives, through our own individual behaviors towards a goal of liberation?
That's amazing. Of course, that makes sense on that level. And I know our yoga teachers out there are really into, caring for their students in such subtle and sweet ways. And this is one of those ways then that we can do that. Now, you told me that you also wanted to talk about something, and it's completely slipped my mind of like, I feel like I don't even grasp it well enough. So tell me what it was that you said at the beginning. Like, here's one piece that I want to make sure I talk about.
Yeah. So I think a way to start out by framing this, well, I like framing it in terms of the context of yoga, but where we might address next is that what is health science? So I can really only speak to health science. I can't speak for other sciences. But health science is not right or wrong. And I think, especially on social media, we get caught up in this idea of like, I'm saying the right thing, or like, no, you're saying the wrong thing. And that's not the purpose of health science. The purpose of health science is to provide evidence towards best practices. And I think when we reframe it from being right or wrong, we can see why it's evolving, which is a very funny science joke. You can see why it's an iterative process, why we keep adding more information. And as we add more information, we change our best practices. So this has been, let me just, I shouldn't speak on behalf of the public health community, but let me just say from the outset that the communication from public health officials and leadership, especially in my country, in the United States, has been an unmitigated disaster. The communication has been confusing. It has not been in any sort of centralized or way that helps people understand what's going on. So I'm hoping that if we put this in the context of health science not needing to be right or wrong, but to give people a sense of what are the best practices right now. And that you and I going through this and hopefully giving people an understanding so that they can truly critically think, that they'll come away with a better understanding of what has been, where they have been really honestly failed by public health communication.
I watched a fascinating documentary. I'm almost done it. I started watching it last night. No one else in my house wanted to watch it. It is called Totally Under Control.
I haven't heard of
it. I think you'll really enjoy it. It's all about how in the United States in the last 5 months, things are not totally under control, and how the leadership and the messaging, it's all basically what you said, in that it outlines the timeline of what's happening in different countries with COVID and the United States and their response to it. And then there are different scientists and medical professionals that are coming and speaking out of like what it was like to be in all of this and the confusion and I mean, we all saw it and heard it in the news, but it's something to see it all compiled together into a documentary.
Yeah.
But I want to touch on what you said in terms of it's changing. Like some people have said, well, I heard this message, like, don't wear masks. And then I heard this message of like, now we're supposed to wear masks. And is that what you're saying about it's evolving? Like there's no right or wrong, and we're just going with what we know now. Am I getting that right?
Right. So in the beginning, Dr. Fauci, Anthony Fauci, who's the director of the National Institute of Allergy and Infectious Diseases, he's a real person. And I just have to say this about Dr. Fauci. I've met him. He would not know who I am from Adam, but I've met him a handful of times. He's a real person. He's had an extraordinary career of public service. And I just want to speak because I know how easy it is to think about people as abstract and having like an agenda of control. If he'd wanted to make a power play, he would have done it a long time ago.
Right.
So let me just put that out there that public health is a very humble profession. So in the beginning, Dr. Fauci did say, don't wear masks. And I said it too. So you can go back into some podcasts in early March where I said the same thing, like at this point, the recommendation is not to wear masks. And so that was based on what I would think about as 3 things. So the first was that there was a very real fear, that was a well-founded fear, that in people rushing out to get the surgical masks, the disposable surgical masks, they would prevent frontline workers from having them.
Yeah.
So that was a very real thing. And we saw this huge run on masks. We saw how our frontline workers still don't have all of the protective gear that they need, which is causing them to get sick, which is not only sad and upsetting for their own health, but if our healthcare infrastructure and these healthcare essential workers, if they all start getting sick, there's no one to take care of us. So, I saw this very personally. I've been having all kinds of health problems around kidney stones. If you've ever had a kidney stone, it's really not fun. And there's just not enough healthcare workers where I live to help address this in the way that it needs to be. It's just a lack of enough people. It's a very unpleasant situation that I hope nobody listening ever needs to be exposed to, which is why we're trying to prevent them from getting sick. The second is, at the beginning of the pandemic, we didn't really have a good understanding of how well homemade cloth masks would work. And then, we circled back around to, it looks like they're having at least some effect, and some effect is better than none. So if we can reduce illness and disease, or morbidity, which is the amount of disease in a population, or mortality, which is the amount of death in a population, no death is better than some death. Less death is better than more death. Less illness is better than more illness. So, we got to the point where, okay, it looks like these homemade masks are having at least some effect. It's a very low risk intervention. And, it's not perfect, and we'll you and I talked a little bit about Swiss cheese, and we can get back to that in a moment. It's not perfect, and especially not on its own. But again, some benefit is better than no benefit, especially when the risks are really, really low. The third aspect of this, I think, is worth really acknowledging is a bit of more than a bit of American exceptionalism. Americans tend to think that we have the best science and the best research, when in Asia, they've been wearing masks, for years, really since SARS and MERS. So those are coronaviruses that happened before. And, my friend, mutual friend and colleague, Yanni Feng, really brought this home to me that, if we had really taken what Asian sciences have pointed out for years, we really could have come to this conclusion a lot earlier. So I think it's worth acknowledging all of those things and to just say, and Dr. Fauci has said just straight up, I was wrong. Now I know better. And that is the benefit of considering science as this best practices now.
Yeah. I mean, if we look at how all science and medicine has gone, that's how it's gone. We, even as yoga teachers, if we look at what we learn in our first 200-hour, and then we go through the years of teaching and we learn something new and we're like, oh gosh, that's the way I used to do it now. Now I don't do that anymore. Now I know this new thing. So that's a great summary of why the let's not wear masks and the switch to let's wear masks. So can you get into some of the details of and I know that everyone listening is from different parts of the world. So they all have different health organizations suggesting different things. But in your opinion, what should we be doing in our yoga classes? Should we be wearing masks in? Do we take them off when we're practicing? Do we teach with masks on? Who needs to be wearing them? And also, how do we effectively, and what's the best way to put a mask on and take it off?
Mm-hmm. Sure. So, as with most things, the answer is it depends. So, if you're in an area where there's not really any community spread, meaning, you see that curve line is very flat, you're not seeing any new cases coming in, and there haven't, this is a long time that it's been that way. New Zealand would be a good example of a place that has been able to go back to relatively normal, although, like in most places, you're going to see waves going in and out and in and out. So we're going to have this ease up a little bit, get the masks back on for a while. In places where there is community spread, which we're seeing quite a bit of in the Northern Hemisphere, a lot of Europe is now experiencing the second wave, or seeing cases really go up for the first time. In most states in the US, it's going up. In Ontario, it's going up. Even just the littlest amount is concerning, because it doesn't take a whole lot for cases to get really out of control. And so where I live, Arizona, is actually a really good case study that we can take. So Arizona was one of the last states to go into lockdown and one of the first states to reopen, and reopening essentially without a plan. So they just sort of reopened, like everybody gets to go back. And the cases very quickly skyrocketed out of control. And like I said before, that was when I had a personal experience of trying to interact with the medical system. And it is a hell I would not have wished on anyone. The hospitals were honestly pretty scary. The healthcare workers were doing the best that they could, but they were just exhausted and overwhelmed. So it was a pretty scary time. And I think that's hard to conceptualize if you haven't seen it firsthand. So much of this is behind closed doors. It's kept away from us and we don't really see. And I think at this point, the numbers, 1.1 million people globally are dead. 221,000 people are dead in the United States. That's sort of abstract at this point. But that's like every person you ever went to school with and then some.
Right.
So I think once we recontextualize it in terms of these are human lives. And then also that it's also a sense of lots of people get sick from this, and we really don't have a good handle on why some people get really sick and why others don't, or the long-term effects. So I sort of digressed from what should we be doing in our yoga classes. That's sort of why we should be doing it in our yoga classes. In areas where there is high or even some community spread, masks on, I would say when you're within 12 feet of people, which is going to be almost any indoor space. So, what the masks do, when you put a cloth mask over, so let's back up a second. So, I don't know how much into this you want to get, but a virus has to have a chain of transmission in order to spread. So, you have to have the virus in the first place. You have to have people who can catch the virus. So you have to have a susceptible host. You have to have a way for the virus to get around. So that's the mode of transmission. Then you have to have a reservoir, a place where the virus hangs out until it's going to go and infect the susceptible host. So at the very beginning, that was in the theory is that it was in civet cats, which jumped to a bat, which then jumped to humans.
Right.
So that's the reservoir. So then there has to be a way, a portal of exit, a way for the virus to get out of one susceptible host or one reservoir. And then there has to be a portal of entry, a way for the virus to get in to a susceptible host. So what we know, COVID is primarily a respiratory illness. So the mode of transmission is through primarily respiratory droplets when you speak, cough, sneeze, sing, project your voice, any of those things. You're opening your mouth or your nose. Sweat and lacrimation, tears are up for debate about, but you know how many people are like going around and licking somebody else's tears, which
Right.
you are, you do you do you at that point. So you have to have these ways of transmitting the virus from one place to another. So our best understanding right now is that the two main modes of transmission are through the respiratory droplets, which are bigger particles that are coming out of your mouth. Sometimes you can see them, sometimes you can't, but the viruses live inside of there. So it's like the respiratory droplets are like little cars that drive the virus from one place to the next. Those respiratory droplets can be projected up to 12 feet, especially when we're doing things like heavy breathing, big sighs and exhales, which we find in a yoga class, which we find in many movement classes. And so we'll get to aerosol transmission maybe a little bit later, but what the masks are primarily doing is that they're preventing some of those respiratory droplets from getting out. The mask is catching them. It's a filter. And so taking off, so at the beginning of class, or really even anytime you're going into contact around people where there's not a way for the virus to get away from those people, especially in indoor space, you want to have a mask on. I'm seeing a lot of people take the mask off once they're on the mat, which doesn't make sense. So what's happening is that even though you might have that 6 feet apart, even if you might even have 12 feet apart, you're still going to be expelling those respiratory droplets. And in a yoga class in particular, that's part of the practice oftentimes. Most teachers are teaching ujjayi breathing. Whether that belongs in yoga or not is another story for another day. I know that that's controversial now.
Right. We won't even touch on that today.
Yeah, that's really outside the scope of what I can offer. But people are going to do it. It's what people believe. Many people at this point believe about yoga. So those big exhales, things like that. The teacher also needs to project their voice to be heard. This is really tricky, right? Because on the one hand, the masks can muffle our voices. On the other hand, when we project our voices, those respiratory drops are going further. So the big case study of this was the Washington State Choir. In a place where there was virtually no COVID, one person who was carrying it and had almost no symptoms went and infected almost the whole choir. So they were doing all the hand sanitizing and things like that, but so many people got sick from it that it was, it shows why we're asking people to wear masks throughout something where you're going to be in close enough proximity to people, and especially where you're going to be doing activities. This is all something around the idea of relative risk. So relative risk is the risk that you would have of being exposed versus being in a place where you wouldn't have this particular pathway of exposure. So we can think of that about time, place, people, and activity. So the amount of time that we're near people, more time with people, more time for the virus to be able to be transmitted. People, the more people we're around, the more ways that the more exits and entrances, the more modes of transmission are available, and it increases just the viral load in the air around us. Place. Are we indoors or outdoors? We know, and I still haven't gotten to the aerosol transmission, but indoors is going to have less ventilation. It's going to have people in closer proximity, stale air, things like that. So we know that indoors is riskier than outdoors, which doesn't mean that outdoors is perfectly safe, but it's certainly better. And again, better is better than not better.
Right.
That is a clumsy way of saying that. And then the last thing is activity. If you have people in, something more sedentary versus something more active, there's going to be a difference there. If you have people giving big exhales, that's going to be different from like a library, which I'm assuming, I suppose, that libraries don't have people giving out big sighs, but things like that. Not that even a library is necessarily a great place to go. That was maybe not the best example, but doing things that are going to involve singing, chanting, heavy breathing, big exhales, projecting your voice, those are all going to be riskier than if those things were not happening. So to decrease relative risk, you change any one of those factors of time, people, place, activity. So that's how you can mitigate some risk, is changing any one of those, so that as you're getting into class, when you enter wherever you're getting, mask on, get to your mask on, and even when you're leaving. So mask on the whole time in places where there's community spread. In places where there's not, it's not really an issue.
So about this mask on the whole time, some people have asked, is it dangerous for my brain am I not getting enough oxygen with this mask on? Do you want to touch on that?
Sure. Yeah. There's a great way to tell this, which is to get yourself a pulse oximeter, which measures your own oxygen saturation. Below 94-ish% is where you start looking at it being a problem. And so you're going to be getting enough volume of oxygen with a typical cloth mask, because it's going to have enough space between the mask itself and your skin that you're going to be getting a good enough volume of oxygen. There's, I think, about 20% oxygen in the air, or 20% of the air is oxygen. You're still going to be getting in enough. And so that concern is called hypoxia, that I'm not going to get enough oxygen. And then hypercalcemia or calnemia, which is where you're worried about not enough carbon dioxide going out. I know that that's the other concern. And that's going to be the same thing, where it's going to get out enough out of the sides. This is why it fogs up your glasses. If you've ever worn glasses with a mask on, that air's going up and out. It's also why masks aren't perfectly effective. The exception to this would be an N95 respirator mask. Those are really not available to the public right now, at least in the United States. And for good reason. That's what we want for our frontline workers. If they are available to the public, there's a good chance that it's a knockoff. or that it's not fit right. So N95 masks have to be specially fit tested. So they sit really snug across your face. You can look up and see the healthcare workers who they come off of a shift and they have like that indentation in their skin. It is hard to breathe with an N95 respirator on. You are going to be getting less volume of air in. Um, and like you can't even have facial hair to wear them. That's how snug they fit on. You would know if you're wearing them. They're uncomfortable to breathe in. They're harder to breathe in. And you don't really want to be wearing one for a long period of time. That said, I know that personally, I had to adjust to wearing a mask and I had to play around with a lot of different models to get the one that felt right for me. I had to practice wearing it. Especially, like I said, I'm in Tucson, Arizona, where we were hitting, 112 degrees this summer. It was so uncomfortable. I really empathize with people who don't love wearing the mask. So, I had to get used to wearing it. I had to practice at home a lot. I had to take it in smaller doses and build my way up. And now I don't mind it at all. I found a mask that really works for me. But to have it fitting properly, you're going to need to have it over your nose. So kind of think of like if the tip of your nose is like a little flower that hangs out, you want to get it up and over that flower. You want to have it all the way over your mask and then down a little bit, at least under your chin. So yeah.
This is really helpful. And also, I just love that you just called out, like, it's not the most comfortable thing if we're in a culture that's not used to wearing a mask. So I went for osteopath appointment the other day, and you think like, it's not like I'm moving around and doing something. It was just a different sensation. Like, it's like having a massage lying in that, where your head's in that thing as you're lying face down. And then I just thought, now my mask is over my face and this is a whole different feeling to it. So I was actually feeling a bit claustrophobic. And I've seen the studies of like, yes, you're getting enough oxygen. No, your brain's doing just fine. But it was like having this conversation with myself of like, no, I'm fine. And my daughter is 15 and she wears a mask all day at work. And she said, you know what, once you get used to it, that's it. Like she said, I would actually feel really weird now not wearing a mask. So I think a lot of it is in our head. That said, I know that, some of our yoga teachers will be in areas where you had said 12 feet. And I don't know, I'd have to check. I think our in-person classes here are saying like 2 meters or 6 feet. Do you want to talk about that as well, of the 12 feet? Because I feel like there was a new study that came out that supports that.
Mm-hmm. Yeah. So the 6 feet parameter is actually based on really outdated science from the 20s. Yeah, it's an odd thing, but I mean, I think a way for people to test this for themselves is to actually just go and blow on something.
Right.
And to see like, for yourself how far that can get. Or just also think about how far away from somebody do you want to be sneezed on? Say you have somebody who's sneezing in class, they're 6 feet away, if you knew you could like even just catch a cold or flu from them. None of us love having somebody with a cold or flu in class. I know this comes up every year in the Facebook group of like, I had that student in class who was sneezing. What do I do? So we're all uncomfortable with it. And so this is also a time to err on the side of caution. The masks are only one aspect of the mitigation of the risk. They're not perfect. So what we can think of is a Swiss cheese model. So any one of these mitigation factors between hand washing and sanitization, wearing a mask, keeping distance, keeping to our bubbles, the only truly safe way is to completely stay at home. I'm going to give a little bit of safe sex talk here. Infectious disease is infectious disease. The only way for truly safe sex is abstinence.
Right.
But abstinence does not work.
Yeah, people want to have sex. Right. People want to go out and see their friends right now, or go see their family in some way, or go to yoga. Yeah.
And so we want to, and so it's really going to depend in every place, so each of these mitigation factors on their own are like pieces of Swiss cheese with holes in them. They're imperfect. But then if you think of a wheel of Swiss cheese, many pieces of Swiss cheese lined up, those holes start to go away, right? One piece of cheese covers up the next piece. It covers some of those holes. So each one of these things starts to catch more and more. In the beginning of the pandemic, we didn't really have a good understanding of contact transmission.
Right.
So this is thought to be a major mode of transmission where you touch a surface and you get the virus. We now know, so this is called fomite transmission. Fomite is any surface that can carry germs, disease, virus, bacteria on it. We now know that it's exceedingly rare, and it seems that hand washing, if you just have good hand washing, just soap and water, Castile soap, great. Soap and water is going to be pretty effective at helping to prevent that contact transmission. So this also goes to one of the questions that somebody in the group had. I think I've gotten way off topic here, but such as
no, this is fascinating. You're doing really well at fitting a lot in.
This goes to some of the questions that people had about sharing props and, how much sanitization should I be doing? So at the beginning of the pandemic, I would have said, you wipe down everything with the, most hospital grade disinfectant you can use. What I worry about at this point is that becomes theater to, places will say, we're doing the most rigorous sanitization, when what we really need to be focusing on is reducing respiratory transmission and aerosol transmission. So yes, keep sanitizing surfaces. I wouldn't want to necessarily share props with people in places where there's less community spread. That becomes less of an issue. Wipe stuff down, ideally with, something that will kill quite a bit of virus. But don't let that get in the way of having these policies and procedures in place to have people keeping distance, keeping to very small groups, ideally small groups of the same people. If people could be running series where one teacher is coming into contact with the same exact group of people each time, that's going to be a lower risk than exposing to new people each time. So it's something called cumulative risk, which is the additive risk of each person you come into contact with.
This is what our schools are doing, because my daughter has one subject for a whole week, and that class stays together with that one teacher all week.
Oh, that's fantastic. That's a really creative workaround.
Wait till next semester, quadmester now that's called, with math and history as the two subjects. We'll see how it goes. But she's actually liking it. It's kind of like batching your schoolwork. So you just do this one subject for a whole week. Yeah, and they stick together. I mean, at lunchtime, it's a free-for-all, and they're teenagers. They just want to go, get outside, get their masks off.
Yeah.
Yeah.
And, I know a lot of this seems like a lot right now. And I have pandemic fatigue. I'm just tired of it all just as much as everyone. My mental health has taken a nosedive, and I know I am not the only one listening who thinks this. And so I also just want to say, with a great deal of empathy, that I sound super functional on top of stuff today. I have days where I just stare at the wall, and it's just overwhelming. And it's like, come on, can this be over yet? The virus doesn't care. Its whole reason for existing is to replicate itself. It has no other agenda other than to try to live and replicate. It's not really alive so much, but it just wants to replicate, find new hosts to replicate. And that's what it will do as long as the trains of transmission continue. We still have so much to learn. it's a baby. It's brand new. This is such an opportunity for us to have beginner's mind.
Right.
So much, and there's so much yet to learn.
I want to ask you, so if you were teaching in person right now, well, maybe that's part of the question, and you don't have to answer that, but it's like, what are you choosing to do in the United States right now? Most of our listeners are in the US. Like, I know some teachers who are just saying it's not worth the risk. It's still all online right now. I'm not teaching in person. You know, other people are like, oh my gosh, my students are craving class so much. I really want to figure this out. In terms of props as well, you know, we're all over the map. So you were saying you wouldn't want to share props, but it would be more important to be 12 feet away. Like, I feel like there's no checklist.
Mm-hmm. Yeah. So let's think about this in terms of risk, because I think that's a way to help people frame how, when, where, why we're taking these precautions. So before I get into that, I'll just give you personally what I'm doing. Arizona, we had that huge spike in July, late June, early July, and we've had little spikes up and down. We're heading in the wrong direction again, like many places. Personally, I keep it close to home, which I also just want to say I hate. I'm
Right.
my hair is a situation. It's terrible hay bale right now. But I have a partner who works with clients, and he needs to keep his income. I have enough online that I'm kind of just eking by. You know, I have enough to sort of pay the bills. So I get groceries. I do go in person to get groceries, and I will do. I go very remote places to get out every Friday. Go on a really long hike. I will. Have a very small bubble. So I have 2 other friends, and I'll sort of trade off seeing them about every 3 weeks or so. I'll get together. We did just have my partner's birthday was recently. And so we brought our little bubble, him and me, together with his friend who, we talked beforehand. It's sort of like a safe sex talk where, we talk beforehand of like, okay, we're all doing masks. We're doing this outside. It was with 3 other people. So there's 5 of us total. And we just all agreed beforehand, okay, so how many people are you guys seeing? Okay. Have you guys been wearing masks? Did you guys have a test? Things like that. And even then I was just uncomfortable. And part of that is that I understand the risk, and I can see it inside of my head of each person that I come into contact with. I just have this little imaginary vision of their aura of all the people that they've come into contact with. So that's the cumulative risk of that added effect. So our bubbles are as big as each person we come into contact with. Right, our quarantines, even, we might not be spending a lot of time with them, but that's still more holes in your Swiss cheese. And I personally like fewer holes in my Swiss cheese. I don't want COVID.
Right.
I just have a sense. I tend to when I get sick, I get like Victorian illness sick, which a lot of people in yoga world do. It can be why we turn to yogas. We just, the traditional healthcare system is not always benefiting us. So I tend to be quite risk averse.
What do we do then when someone is telling us, I don't believe in wearing a mask. I think the whole COVID thing is a hoax. It's a plot by the government to track us all and keep us all at home. What do we do when we bump into this then?
Let's bookmark that because it's really important. I want to go back for a second of the different concepts of risk because I never actually got to that. So 4 concepts of risk that we can think about. And the first, like I said before, is relative risk. So time, place, activity, and proximity. Then there's cumulative risk, the additive risk of each person we come into contact with. And that takes us then to pooled risk. meaning that the person with the highest risk behavior sets the risk for the whole group.
Right.
So even though I might be very conservative and very risk averse, if I have somebody in my cocoon or quarantine or pod who's engaging in higher risk behavior, that person's risk is my risk.
Right.
So that goes back to how much this is not an individual thing. And then there's collective risk of that speaks to how our own individual actions are affecting the most vulnerable in our population. We're trying, and I can't say this enough, that all of our actions are for the well-being of people who need our most tender, loving care, people who are at the most risk, which then goes to public health really has an aspect of social justice built into it because we're trying to protect BIPOC people. We're trying to protect people working with disability, people who are our elders, our wisdom keepers, things like that. We want to take care of them through understanding this collective risk. So 4 different ways to think about risk. And so if you kind of put yourself through that thought process of, the relative risk, considering time, place, people, proximity, activity, cumulative risk. If I'm coming into contact with lots of people, I'm increasing the viral load that I'm exposed to and that all my people are exposed to, which is that pooled risk. And then all of this being for the collective well-being.
Right.
So that's getting back to your question, to answer your question about what do we say to people who are like, well, this is a hoax, the government is trying to control us, and I won't wear a mask. First, I think it's important to address that this is a very vocal, big minority. We're seeing people really keep up the mask wearing. Most people, especially people of color. So the highest group of people who are wearing masks are Latinos, followed by Black people and Asians. And it's interestingly enough, white people who have the lowest rates of adherence. Right. So
Interesting enough.
right. So
Is that because of our privilege?
I don't know. But then when I think about fears of the government controlling us, well, we have to look at a culture of colonization where there are a lot of people who have a sense that they don't have control in their lives, that somebody else is making the rules for them and they're not fair. And honestly, Shannon, a pandemic is not fair.
Right.
It's not fair. And we, in the United States, we have been failed miserably by our leadership. And it is unfair. I am straight up jealous of people in New Zealand who are having fairly normal lives. It's not fair. And so I just want to address that reality that there is a sense of this is not fair and I'm not getting to be in control of my own life. And maybe if we can acknowledge that, it gives us the leeway to flip that around, that while I may not be able to control this, I do have a choice to help care for other people in these little ways, these subtler ways that, and a lot of, we're making huge sacrifices. Many of us are sacrificing our livelihoods, our businesses, our, even rent. It's terrifying.
Mm-hmm.
So it is scary. So I think just having empathy and acknowledging that, no, it's not fair. And it does suck. It's uncomfortable, things like that. And then there's just always going to be a subset of the population who is against it. And you just don't fight with them. Just let them be. It's,
Right.
Because you're not going to change their minds. So you find people who are kind of at the cusp of like, should I do this or not? And we work with where you are. And if that's where you are, I get it. I absolutely understand. And I think if we can reframe it as an opportunity to show our love, our care for the most vulnerable, that is the foundation of our yoga practice. And that's the foundation of public health.
That's amazing. I think this has been so good to like get into the real information. Oh, one thing I wanted to ask you about was you said we will look at the respiratory droplets, but also aerosol spread.
Right. Yes. So aerosol spread, which took a long time for the CDC, the Centers for Disease Control and Infection here, or prevention here in the United States, took a long time for the CDC to actually say that aerosols do play a role. And that's because it's hard to show that. Basically, what you'd have to do is put one group of people in a room with aerosols infected with COVID, and another people in a room without that. And that's what we call unethical.
Right.
So we've been trying to do our best guesses. So what aerosols are is they are the teensy tiny littlest particles that come out of our noses and mouths that are so small that when they hit the air, they either reduce the respiration around it or evaporate, leaving in the air the virus nuclei. And it seems to last in the air for about 3 hours is the best understanding right now. So what we also can't tell is how much of that virus it takes to breathe in to become infected. So that's why they were loath at first to really say that, even though many in the public health profession and many doctors have been saying for months and months that, yes, this plays a role. It's also why we're seeing rates of indoor infection more than rates of outdoor infection.
One of the examples in this documentary was a karaoke room. You know, it's like two people from their own bubble would go in, sing their little hearts out, and then more people would come in, and they realized that was a big cause of the spread in, I believe it was South Korea.
Oh, that's heartbreaking because karaoke is so fun.
I know, but I wonder if that's why, if it's like aerosol. I mean, it's hard to know, I guess.
Yeah, and it's hard to separate these things out. They're called confounding factors, where it's really hard to say this one thing has an effect. A way to think about it is cigarette smoke. So imagine you took a puff of cigarette smoke, and guess who's not a smoker? I'm like trying to describe smoking. Imagine that you had a cigarette, and somehow under your mask, you were able to breathe that in. And then you breathed it out. You'd have the cigarette smoke kind of come out on either side. And then I think it's hard for people to think back to the days when there were still cigarettes in restaurants, and you had the non-smoking area and the smoking area. The whole restaurant still smelled like cigarette smoke.
Yes.
Right. So that didn't contain the cigarette smoke in the one place. So again, that's why we have these multiple pillars of risk transmission. And I also left out one of the most important ones, which is creating a collaborative community. This is one that we really haven't done a great job of, but bringing people to a sense that we are in this for each other. You know, we keep coming back to this is an infringement on my rights. But if one of our pillars of mitigation is a sense that we're doing this for each other, that plugs up some of those holes in the Swiss cheese, because we're more likely to remember, oh, why am I doing this? It's not just for me. I want to take care of other people. I want to do this for my friends, my family. I love my students. I miss my students, but I want to do this for them.
Yeah. Oh, that's so true. I've heard different people, even my teenagers, were like, how can I go see great grandma but not get her sick? You know, like they're really, when it's someone that you love and you know like that, and it's kind of like we need to be thinking of all the people walking around out there like they're the grandma. So I don't know if we have given our listeners, you know, I don't know that it's possible to give them like, here's what to do in terms of the distance of your class. like I'm getting the sense from you that we really have to weigh the risks, also follow what our local health unit says, but to really understand the knowledge and then make those choices. But part of me, what is it in me, wants to be like, here are the recommendations. If you're going to have a yoga class, you're 12 feet apart. Is anyone telling our yoga teachers this? Are there other places like?
Well, let's put it in terms of, you know what I was actually shocked by?
What?
Yoga Alliance.
Yes.
I actually put out a great document. It does not outline these things, but I was like, wow, Yoga Alliance, which, again, leave yoga politics maybe out of this, but wow, Yoga Alliance. That was a pretty good document. Okay, well, let's try to make this a little simpler. The least risk is having online classes. That's what I'm doing. That's what a number of teachers I know are doing. Fine to say you hate it. Fine to say you miss students, but it's going to be the safest. Next, least risky. Outdoor classes with the same group of people, ideally good distance apart, ideally wearing masks the whole time. So we're going to have to adjust our teaching, might mean we're not doing the heaviest classes, things like that. It's also, I understand that there are other parts of the world that are becoming cold. Here in Tucson, we're cold at 97 degrees, which I don't really know what that is Celsius, but it's like 1,000,000 degrees Celsius anyway.
We're looking at snow here soon.
Oh, yeah. So that's going to be really difficult for people. I understand that outdoor is becoming less of an option in some places. But if we can do outdoor, better than indoor. The next, if you have to do indoor classes, don't have them in an area where spread is going up. Just it's unwise. If you're in a community where there's low spread and you want to have indoor classes, aim for places where you can have very good ventilation. Open the windows, even just a crack. Open the windows. You want to have the air circulating through. You want new air coming in through that room. So ideally, open windows is going to be best. Good ventilation systems that can exchange the air quite a few times. They're expensive, but worth it. HEPA filters that can filter out microns up to 0.05 microns. Those are going to be useful. Look at how many square feet that covers. So I think the challenge also be having classes ideally with the same group of people. So this is one aspect of social distancing that gets less focused on, is that we're also keeping to small groups, trying to minimize that cumulative risk. So a series with the same people is going to be better than having new people each class. So especially individual teachers, I think, listening to you and Francesca, this is also a great way to build up your following, is by having these loyal students coming to you over and over. That's going to sustain us through this. Then keeping as much distance as you can between mats, keeping the mask on the whole time, keeping classes to small numbers, 6 people. I realize that this is financially unviable for a lot of people. And I realize that's unsatisfying. And it's just the trade-offs that we're making to keep people safe. The most risky would be an indoor yoga class with a lot of new people who you haven't come into contact with before, who are not wearing masks, and there's not very good ventilation. So I'm trying to think if I've left anything out.
The props would be the only other thing.
Props, the least risky is no props. Less risky is props, people bringing their own props. More risky is which is not the worst risk in my opinion, and what we're seeing from the science, cleaning the props in between, ideally with a good sanitizer, cleaning them at all better than not cleaning. So that's sort of the the list of that. Things that are softer surfaces are going to be worse than harder surfaces. So wood blocks. This is a great time for people to have chairs for yoga. They're pretty easy to clean. Things like bolsters and blankets, those are going to be a lot harder to clean.
Yeah.
So the more people can bring in their own, the better.
This is really interesting. Also, there was some science that came out recently that said maybe in colder climates or colder temperatures, maybe the virus can stick to some things. I think they were testing money in that and looking at that. And I was starting to think of like, what about our yoga studios that are in these colder places?
If people are washing their hands a lot, if they're doing really good hand washing, 30 seconds, you get underneath your fingernails, you get in between your hands, and you wash all the way up past your wrist bone. So think about like all the medical TV shows where they're like doing the full on scrub. If people are doing hand washing really well, then they're going to be reducing the amount of germs that could be going on, of the amount of virus that could be going onto those surfaces. If they have picked up virus from surfaces and then they go and do really good hand washing, then that's going to decrease the risk of transmission.
Right.
Hand washing, more preferable to hand sanitizer, but hand sanitizer is good enough if you're using it properly, which means a good glob, like at least a quarter size glob. You get it on all the same places you would for your hand washing, underneath your nails, things like that. And you have to let it dry. So I see, and I have done this, where you have a little extra on you and you wipe it off. You just got rid of the part that kills the germs. So you want to have it dry all the way, which is why hand sanitizer tends to be less effective than hand washing, as we just simply don't do it right.
Right. Oh, this is fascinating. Thank you for explaining all of this. If our yoga teachers want to take a yoga class with you, or like, how can they do that? How can they find you? Or do you have space for more people?
I do. So right now what I'm doing in life is I am running a Patreon channel. So it's called Wild Wisdom, where I am combining all of these things. So I'm writing, I just wrote a really long essay to explain where we are with vaccines, which actually somebody asked a question. Let me get back to that in a second about what's the next year going to look like.
Oh, yeah.
Bookmark that. Okay, so I have this Wild Wisdom, my Patreon channel, where I'm combining writing, explaining these public health things. I do my own memoir writing and talking about different things that are affecting the wellness world right now. I'm having online classes for movement, exploring that twice a week. We do forest therapy invitations, nature therapy invitations. I have meditations on there, guided meditations and relaxations, and other things that we're just exploring, of all of these different ways, ancestral connection, to tap into our well-being. And then I'm also working one-on-one with a handful of people, and I have a few slots open for people who want to work one-on-one.
Oh, that's amazing. That sounds so good, like a way to have a group. And still, I hear lots of things of like getting outside and getting out in nature and moving and not just the sitting on your screen time. So what a nice balance that is. So where would people find that then?
That's patreon.com/movementfeelingsnature.
Okay, we'll make sure that we put the link in the show notes.
Mm-hmm. To address one question that was in the group.
Yeah, no, you go for it. I think it was Rebecca who asked this question. Was it Rebecca?
Which one are you thinking?
Oh, maybe hers was a different one. Gosh, there are two of them. Rebecca had a question of like, why am I still getting a cold? I'm doing all of these things. Why am I still getting a cold? And I just feel like, you know what, Rebecca? I have a herniated disc and I feel like I was doing all the things. Like I move, I try and reduce my stress. I try and stay educated about my body. I try and look after my emotional health. And still the body has times where it's not this perfect machine. It has times. And I feel for her in this.
Yeah.
Because we're in this profession of like, well, if you do all of these things, you won't get sick. I'm sorry. I don't agree with that.
Right. We were never guaranteed perfect wellness and, well, maybe perfect well being because we get to define that on our own terms, but we are not guaranteed perfect health. And I think there's this real cult of like, if you have your health, you have everything, which is really discouraging if you have like a chronic condition, an invisible illness, if you do tend to get sick. But, Rebecca, you did everything right. There's just holes in the Swiss cheese. The only way to prevent that is to stay at home by yourself, which who's going to do that? That's not even good well-being. That's goes against, being a human. So
Exactly.
it makes me think too. I was working in Uganda at some point where there's malaria, risk of malaria, and I had been taking prophylaxis. And I remember being out one evening with my boss, and she was like, "Could you please put on your long sleeves and pull up your socks? Don't expose yourself to getting mosquito bites." And I was like, "But I'm on my prophylaxis. You take something just in case you get a bite so that you try not to get malaria." And she was like, "Claire, all it takes is one bite.
Right.
Why not get fewer bites rather than more?" So really all it takes is just being in the wrong place at the wrong time. It's not karma. You didn't do anything wrong. It is just bad luck and a virus being a virus. So the other question.
Oh, it was Inga who said, "What do you think will happen next year? Do you think masks will still be required? What's going to happen to our traditional yoga studio?"
Well, that last question is a much bigger question than I feel qualified to answer, because what COVID is exposing is a whole lot of systems that weren't working. And I think the traditional yoga studio is one of those. So I'm going to leave that to a larger discussion for another day. What does the next year look like? I believe 2021, I believe it will be a reserved year. In terms of vaccine production, I do expect that within the next 2 months, they will announce the approval of a vaccine. Now, the approval of a vaccine is very different from being able to get a vaccine. So right now there are 4, I believe, vaccines in in phase 3 clinical trials, which is the last stage before they can come to market. So what they have to do is they have to recruit huge numbers of people. These studies have 30 to 60,000 people in them. One group gets the vaccine. The other group gets a placebo. They're made to think that they have a vaccine. The people giving them don't know who gets what, and the people receiving don't know who gets what. So it's double blind. They have to wait around for there to be enough infection to show that the group that got the vaccine has enough efficacy, that there's enough infections prevented, which we think is around 60%, to say that the vaccine is going to prevent enough to achieve herd immunity, which that term has gotten really out of hand recently, but herd immunity refers to vaccination. That is what it refers to. Natural herd immunity does not exist. It's bad. I can't go into detail. I can go into detail about that, but back to vaccines. So it's a waiting game of just waiting for enough people in the trial to get this infection to trigger the efficacy signal. There is one person, the statistician from the Data and Safety Monitoring Board, an independent group from the people sponsoring the trial, who can see the data. And when they hit that target, they then tell the company. The company then tells the FDA. The FDA tells like the White House, things like that. So, the American president will not know this first. Dr. Fauci will not know this first. The statistician will know this. And we have to hit those targets to say that the vaccine is safe. So what's happening now is something unprecedented. Why this is moving at such fast pace is because at the outset, all of these different research groups started working together. They agreed on the ways that they would share data and what the data meant so that they could bridge from one trial to another, so that even if one trial didn't work, other researchers could share that information. That's very unusual. That tends not to happen in science world. It tends to be more competitive between different groups, but everybody's working together on this, which is cool. What happened is that these companies and NIH and other groups, health agencies in other countries, NHS in the UK, they have taken these trials at risk. Sounds terrifying because it sounds like we're taking a risk on the safety. That's not what that means. When we're saying that they did it at risk, it's a financial risk. So they have already, when they get to these phase 3 clinical trials, they pour money into production, into just getting the production going so that when a vaccine, if it is shown to be safe and effective, that once they say, yes, they can go to market, that they already have some of it ready to go in production. The scale of the number of vaccines that will have to go out is millions and millions and millions and millions of people. And then we have to strategize who gets it first. It's probably going to be frontline workers. So then we have to get enough of the population vaccinated that we have enough disease prevented to prevent the healthcare system from collapsing if there are big waves, and to prevent the most vulnerable in society, which I would imagine that's really going to be towards the end of 2021, 2022.
Right.
So life's not going to be normal for a while. I think we're going to go through, I think in the US, we're about to go through some difficult times. We already are seeing that start. I think that's starting to happen in Canada as well. Europe is seeing that. People are starting to realize that, leadership saying we're turning the corner. No, not yet, but we will. Life will become normal again at some point, and not so far off, but we just got to stick with this for a while. Some good news is that in the Southern Hemisphere, they had they had very low rates of flu infection. So that's really exciting news, because it turns out that the same things that protect against COVID protect against the flu. And that, along with having really good flu shot campaigns, really kept that level of influenza low. So I would love to see, us in the Northern Hemisphere mimicking that, of having really low rates of flu.
Claire, thank you so much for your time. I'll make sure that we send people over to patreon.com/movementfeelingsnature if they want to work with you more. Just thank you so much for sharing your wisdom, and also being really present in our Facebook group and checking in with people and helping us along the way. Thank you.
Yeah, thank you. And thanks for making this happen and trying to get the word out. And let's just all keep taking care of each other. We look out for ourselves, but we take care of each other.
Thank you so much for your time, Claire. And also thank you, Connected Yoga teachers, for really deciding to dig into this. We know that mask wearing has been one of those hot topics that can create a lot of controversy and different opinions and raise a lot of questions. So I'm just excited that you had a listen. And the real intention for this episode is to give you the information so that you can make empowered choices. And I would love to hear from you if you felt like there was a piece of information that really hit home, or if you feel like you have further questions. I feel like I had so many key takeaways from this episode, like how public health weaves into the yamas and niyamas of yoga, why there was so much confusion around masks at the very start of this pandemic, and the best practices and how that evolved. Just like we learn as yoga teachers, this is something that has evolved as we've been in this pandemic, which is a really new thing for most of us here on this planet. I love how Claire explained about the oxygen level and how we can find comfort of that during our class, and the Swiss cheese model, the 4 types of risk. I feel like there was so much information packed into this episode. And at the end of the day, I want to tell you a couple of things personally. One is that what helps me at the end of the day, because I am a really social person. I love to hug people. I love to be around people. I love to just, strike up a random conversation at the grocery store with someone. And I thrive on that. So this time of the pandemic and facing lockdown, one thing that holds me in the tougher days is to think that I'm doing this for my community. It's not just about me. I'm really doing this for my loved ones around me, but then also the greater community, the people who I don't even know. And I've actually started to think about how I can do this even more. Like today, a friend of mine was dropping eggs off at our house. And when she does that, we both wear masks. I have my mask near the door. So it's just like this caretaking that I can do as she's driving through and delivering groceries to my door. The other personal share that I want to do, Connected Yoga Teachers, and bear with me right now because I feel like it's really raw and it's really close, is that I got the news this morning that a cousin of mine, it's my dad's first cousin's wife, has passed away due to COVID. It's heartbreaking on so many levels for our entire family. There was a family update that went out, and I was just chatting with my cousins about this. And one of the updates is that, so my cousin and his wife have been married for 54 years. Hats off to anyone who's been married for over 50 years. That's amazing. And he also got COVID and was obviously unable to be there with her when she was in the ICU and intubated. We know those stories from around the world. It's something when those stories really start to hit home. And then also today, as he's facing the loss of his wife, is unable to be with his family right now until he gets a negative COVID test. He's making this sacrifice. His family's all making the sacrifice of not being together because it's the best thing for everyone. And when you know the individuals involved, it seems so heartbreaking. It seems so unfair that we can't, immediately be with our loved ones, or we can't be with them as they pass. I'm still doing a lot of processing of this. We're at the point in my family where people are starting to post memories and photos and really start to pay tribute to this amazing person who I just know that I gravitated towards every year at our family picnic because of her really witty sense of humor, kind of this person who you knew you could sit beside and who might tease you, but definitely would never judge you. Just this real safe mothering, but also such a quick and witty personality. So as you're out there, and as you're making these really tough decisions, please know that you are taking care of yourself and your community in a way that a lot of people aren't going to see, and some people aren't going to understand. And I'm hearing from a lot of family and friends who are facing different decisions. I also want to really send out just a lot of thoughts to any of you who are in the same boat where you're dealing with the loss of a family member, or you're dealing with just, different opinions around everything that we're dealing with in this pandemic. It's a lot. And so my heart goes out to you right now. I hope that this podcast is supporting you. And if there are questions that you have or challenges that you are facing, please know that you can continue the conversation in our Facebook group, or you can send a message to me. I want to thank our team over here, Suzanne, Crunch, Nick, and Sinead. You just are all doing so much work behind the scenes, and I am every day grateful for that work that you are doing. And I want to thank you, Connected Yoga Teachers, because we've hung out for quite a long episode here today. And before I sign off, I want to know what you will be doing this week to stay connected. Maybe that's to yourself, your yoga practice, or to your community, so that you can share the yoga that lights you up.